Hi, this is Nick Earl, CEO of Eseye, and welcome to the IoT Leaders Podcast. We're in the field of healthcare again this week, and in particular, we're going to be talking about life or death, not of patients, but of medical materials, human tissue, embryos. How do you ensure that you can meet the regulations in terms of vaccine? How are the regulations changing? And how does IoT enable all of that? My guest this week is Fred Rowe. Fred is the SVP of sales for a very interesting US-based company called PharmaWatch, based in, as you'll hear, Boise, Idaho. They are one of the leaders, if not the leader, in the area of human tissue monitoring, vaccine monitoring, and in particular, they are the leader in the IVF, in vitro fertilization field, where we're monitoring the things like the temperature or air pressure or other physical characteristics of the containers that store this material is absolutely essential to whether or not the process is viable. So, think of embryos. If you get it wrong, it is literally a life or death type situation for those embryos. So it's a very, very important field. Fred's got a great story to tell. And not only that, it's the first time we've had a case study of our new SMARTconnect capabilities, which you'll hear in the podcast, actually puts the switching logic into the device. And Fred's got a great story of how they were the best performing company when the Rogers had unfortunately, had the 19-hour outage in Canada, and how Fred's devices were not affected by that. So I think it's a great podcast. It's really interesting, and it's yet another in the theme of healthcare and the innovation that's going on there around the movement towards continuous monitoring, which is a theme of all of these podcasts. So enough of me. Let's get going with my podcast with Fred Rowe of PharmaWatch. So Fred, welcome to the IoT Leaders Podcast.
Thank you so much, Nick.
It's great to have you. And I know you've got a great story. You and your company, PharmaWatch, that you work for, have got a really great story in multiple parts. But before we get into it, let's do the who is Fred and what does he do part of the podcast. Maybe you can introduce yourself, what your role is, and then we'll get into what the company does.
Great. So my name is Fred Rowe. I'm the Vice President of Sales for PharmaWatch. So I lead the sales team. I also have an engineering background, a varied background that includes industrial monitoring and cellular connectivity. And so this was just the right place for me.
Great. And most people listen to this podcast, just listen to it, and some people watch it on YouTube. So for those of you watching on YouTube, you'll see Fred has got a beautiful picture of some hills behind your head. So that gives me the opportunity to ask you, I know that's a virtual picture, right? I know you're not outside, but
Right.
what is the picture that we're looking at?
This is the Boise foothills. So PharmaWatch is headquartered in Boise, Idaho. And so what you're looking at there is the Boise foothills. We're on the edge of a high plains desert and the edge of the mountains. And so right through those clouds there are the mountains right behind the foothills. Yeah.
Great. All right. Okay, great. All right, Boise, Idaho. So this is in the healthcare space, this week's podcast. And PharmaWatch, I know, is a very exciting company that's doing some really cool stuff. So again, just to explain to everyone who perhaps haven't heard of you, what does the company do? What are the main lines of business?
So we service the healthcare industry. Mm-hmm. And what we do is remote continuous monitoring of environmental conditions and alerting if those conditions go outside a range that's required by the user.
So can you, to make it real, give me a couple of examples of sort of use cases?
Yeah, so we work with hospitals, with clinics, with anyone that is in a very broad healthcare industry. And so if you, for instance, need to keep a pharmaceutical or human tissue, any sort of material under controlled conditions, or even say in an operating room, and you need to keep the air clean inside, and so you need to maintain a differential pressure between the inside and the outside to make sure you have no unfiltered air coming in. Any sort of environmental conditions that you need to control and you need to monitor, that's what we help you do. We help you monitor those, set up the limits for what's okay and what's not, let you know 24 hours a day how those conditions are and if they are trending out of range.
So your customers are the, I guess, the clinics, but also because, obviously, full disclosure, you're a customer of ours, and that's why we invited you on, because we're going to get into some really cool stuff. But I also know you've done a lot with talking about that. You've used the word need a lot, and of course, it really is a need. It's not a nice to have; it's a need, because I know that you, for instance, have done a lot in vaccine distribution.
Yes.
And where we hear the stories of the last 2-3 years about things like the Pfizer vaccine, for instance. I remember when it was introduced, and they talked about the temperature it had to be kept at, and that's the sort of area you get involved in. And I think there's another area which we'll come to, but that's a big deal for you guys, isn't it?
It is, and so every facet of healthcare has regulations that they need to adhere to, and they need to monitor to do that. But those are there so that you can maximize the outcome, the positive outcome to a patient. And that could be, a therapy. It could be a vaccine, and making sure it's viable, because it needs to be stored under controlled conditions to make sure it's viable. It actually works and the efficacy is there. If you're talking about human tissue, it can be the matter of life and death to make sure that that is stored in the right conditions. So the real the regulations that are there to make sure you're maximizing positive outcomes for real people, for their health and their lives.
So for those of us who don't work in this field, we can just drill down on that a little bit. So let's take something like vaccine. So vaccines, COVID vaccines, are being distributed, they're being moved, they need to be monitored. It's tightly controlled, like you say, from a regulatory perspective. And am I right that if there's a set of norms, I guess, temperature range, for example, is one thing, pressure, but also temperature. Yes. And if it goes outside that temperature range for a certain period of time, what are the consequences?
So typically for a vaccine, it would have to be in long-term storage. It needs to be kept very cold to make sure that it's shelf stable, essentially. But that shelf has to be very cold, in very cold conditions. Once they are approaching a time when they use it, and they take it out of those cold conditions into cold, but say a typical refrigerator range, the clock starts ticking on how long that vaccine is viable. It starts to break down over time at the warmer temperatures. And so you have just a short period of time, days or weeks, before you have to use it, depending on what temperature you're storing it at. When you take it out of that refrigerator or freezer to actually administer a vaccine, then you have an even shorter period of time. And so all of these things, those stages, have to be timed correctly, they have to be controlled correctly, and monitored, watched very closely. And so if, for instance, someone storing a medication or a vaccine they're aware of the temperature going out of range, they usually need to contact the manufacturer. They need to quarantine that material and make sure it's not given to a human until the manufacturer tells them, I need to see your data. I need to see how high the temperature went and for how long. And the manufacturer knows that best as to whether they need to dispose of that, which is a terrible waste when you have a shortage of vaccines.
Exactly. Yeah. I mean, that's what I was kind of getting at. I mean, especially in the early days of COVID, there was a huge shortage. And so if you get it wrong, the vaccine manufacturer basically tells you to junk it, right?
That's right. And that happened quite a bit during our latest pandemic. Exactly. And there are times, however, when if you can show them the right data, enough data, and you have a resolution of that data, you can tell exactly how long it was out and by how much, the manufacturer can say, this is still good. You can put this back in with the rest of the group, and you can administer it.
So it's good. It's good for, it's the regulator needs it, because the regulator wants the data, and the clinic say, absolutely needs it because they have an obligation to administer it under the correct conditions.
Right.
And so they have a real need for it. And I guess when you talked about human tissue, which is
Mhm.
pretty broad, and as I understand it, it's not just literally, well, human tissue, but it's also you also do a lot of work in the embryo field, right?
We do, and we do work in a broad range of human tissue. We do work in blood and blood storage, organs, corneas, and also IVF. And that's one of our essentially it's our largest growing area in recent years, is in vitro fertilization, storage, and clinics of that genetic material. And that's very, very critical. It needs to be kept very cold, very stable. But if you do, then it's viable for indefinitely, essentially.
But of course, it's one thing throwing a vaccine out; it's another thing throwing someone's
Material like that is finite.
fertilized embryos.
That's
Yeah,
right. It represents the hopes and dreams, of people,
right.
and life. It is life.
Wow, this is a life and death use case. I
It
mean,
is.
in that
Yeah.
case, all right. So we've got a good overview of kind of the areas that you operate in. I know you're one of the biggest, certainly one of the biggest companies in this space in North America. Um, and so, what? How did people used to do this?
Mm,
Because you've been operating for just a few years.
mhm.
Uh, but and you've gone through several iterations of technology, and we'll come back to that. But before, sort of IoT capabilities to do this, how did people have been moving tissue, they've been distributing blood,
Right.
uh, IVF's been around for a while. How did people do it before IoT?
Well, so depending on the space they were in, there are regulations, but most of those regulations, what they required at the time was to use uh, methods that were within reach of the average clinic, the average hospital, the average user. And so for a very long time, what that meant was actually taking measurements by hand with a thermometer, writing those measurements down in a paper form, and perhaps only one or two measurements a day.
Wow.
That didn't give you the resolution to be able to do what we're talking about in modern times with being able to know whether something is still going to be efficacious.
Yeah.
And so, whereas that's how it was done for years, and there are still some customers that we bring on board today that are still using that method for the most part. Over time, though, Nick, what happened was they started using electronics, but they would use essentially a digital thermometer that had very low resolution. And by that I mean the data points were maybe only taken once an hour, maybe once every 30 minutes. And whereas that's much better than the previous
Yeah.
version,
What can go
uh,
wrong?
it can. In between those times, in between an hour, you can have a complete excursion of temperature and bring it back in, and you would not see that. You wouldn't know that something happened.
That somebody left a fridge door open for 15 minutes and then closed it again, and then by the time you take the measurement, it all seems okay, but actually you've had a
Right.
disastrous incident. And
That's right.
yeah, it is fascinating, and the breadth of what you do is really really interesting. So let's pivot if we can, Fred,
Yes.
because we want to get into the journey that you've
Yeah.
been on. And so when you joined PharmaWatch, I think you guys, you knew what you wanted to do, you knew what the opportunity was, you knew there was huge demand, but it seems like connectivity, the highest possible connectivity is really critical to your use case. I mean, this is one
Right.
where, I mean, the closest you can get to 100% at all times and continuous.
Critical.
You said right at the beginning, use the word continuous monitoring.
Yes.
And we've had a few podcasts on continuous monitoring, like the one we did recently with Bioformis, which I'd encourage people to listen to. They talking about continuous monitoring in healthcare being the next big thing. But you guys, I believe you started off with trying to solve this problem with Wi-Fi. Is that right?
Yeah, that's correct. And the Wi-Fi was available at the time. It was ubiquitous, and so that's what we went with. And Nick, it was a great product for its time. We had something on the order of 96.5% of our data points were exactly on time, with a small portion of that remaining 3.5% being coming soon, right afterwards. But I should probably explain, Nick, that amount of connectivity, the percent of time that you're sending data on time, is critical. And so the remaining time between that 96.5 and 100, that represents all of the opportunity to get close to perfection. That percentage represents the entirety of the risk that's still left there. Yeah, to our users, to the patients. And so we were able to reach that point where we hit a plateau. And as you probably know, as probably all of the listeners know, robustness of Wi-Fi connection varies broadly where you go.
I mean, it just well, first of all, it wasn't your Wi-Fi, it was the hospital or the clinic's Wi-Fi. So you're not.
That's correct.
And so all it takes is, I mean, often it's just human error, right? Isn't it? Someone unplugs the Ethernet cable, or
with
someone
best intentions, perhaps
upgrades. They change the password.
That's right. That happens frequently. And so that is essentially that remaining amount of opportunity we had to reduce the risk was out of our hands, and we needed to bring that into our hands. And so that's why we started looking at other ways of connecting where we could get above that plateau. And we originally started looking at cellular IoT because we felt that put it more in our hands.
Yeah. So we've kind of sized the objective of the IoT project. It's to actually eat into the 3.5%, because as we said earlier, there are loads of use cases where 96.5 would be, wow, that's fantastic, victory. But actually, when it's human tissue, embryos, human tissue vaccines, 3.5% is a really, really big deal. So eating into it is not easy, especially in a world of fragmented cellular, different operators. We talked a lot about that in this podcast series.
Yes.
Everyone, they make a lot of claims, but the fact is that achieving near as damn it 100% is a very difficult thing. And it's also very dependent on the capabilities of the device. So let's go to the next stage of your story. So it's phase one, Wi-Fi got to 96.5%, which is good, better than paper.
Yes, by far, because you also have transcription errors. People
write their own stuff down. They, human beings make mistakes, right? So then you went for your first attempt at a cellular solution, and what happened there?
Well, it was better. We saw about a 30% reduction in that 3.5%. That it brought us down about
over 1%. Yeah, just over 1%
and so it was
reduction. Yeah,
it was great, but we didn't feel it lived up to the promise that it could. And I'll tell you. So when we did that, we chose pretty carefully what we went after, and that was a single cellular band that was known to better penetrate buildings. And that's one of the issues that you have when you're installing in a pharmacy that's in the basement of a hospital. And so that was very important to us. So we were able to reduce about that much, but it didn't live up to the promise. We knew that we could do better, but because of that single band, it may penetrate better, but it's not on every tower across the country or the world.
Yeah, and that's a good point. And we do have a lot of technical listeners. Yes. A lot of people in the industry listen to this podcast. I found out when I go to shows, we say, "Oh, you're the guy who does that podcast." I mean, you have these things where something's technically possible, but then you say, "Well, yeah, but is it ubiquitously available everywhere? Is every tower enabled with that?" Well, no, not quite. I mean, my favorite one at the moment is narrowband IoT, which everybody wants to talk about. Right. And it sounds great, but then you say, is there such a thing as global narrowband IoT? Well, no,
you're correct.
Yeah. So anyway, so you got about just over 1%. I mean, my maths is right.
That's right.
You got to 96.5 to
about 97.5.
97.5, 97.8. But still, I mean, you're in the difference between 100% and 98.5% in business impact terms is a lot more than 1.5%. I mean, it's not a 1.5% problem. It's a big problem. And so, of course, that's where our journey kicked in. And so now, obviously, you are one of our customers, but maybe you can share, in your own words, what's sort of happened since you started working with ourselves, and what's the, if you can share, what sort of progress have you made on eating into that number?
Yeah, I can. So I'll tell you, working with you has been very good, and we can talk more about this after. But essentially, we knew that as innovators and moving forward, we were aiming high. We also innovate very quickly, and the results matter. And so we were very careful in choosing our next partner, which is Eseye. And we felt that it was the right thing to go with for many reasons. But what I can tell you is the solution we chose with you is a multi-carrier, multi-band solution. And it essentially has many options. If that narrow band isn't the one that works for you, because of what's available, it finds what is available. And so far, and we're working with you together every day. We're making even greater improvements, but we have taken what was left, that 0.25%, and reduced it to less than 1/8 of what it was. We've gained another 7/8 of what was left. And so, we're in the 99.6% range right now. It's as good or better than what we expected and what we were shooting for, and it's getting better every day.
That's very cool. And as you say, it's getting better. It's creeping up towards that holy grail.
It is.
A holy grail of the number. So I want to, which is great. For mission critical use cases, you've got to get as close as possible, and it's not easy. It is not. It's a variety of things. It's a lot to do with being completely agnostic from an operator point of view. It's a lot to do with being able to do problem resolution without having to raise tickets on the operator, so to be able to do it quickly without having to wait for somebody else to get involved. And in particular, which is where I'd like to go now, it is everything to do with the device. It is everything to do with the device and the device's capabilities, which we always talk about in each of these podcasts. And in your case, Fred, and your company, you've got a very interesting story on the device, because you just used a phrase there, which is, if narrowband isn't available, the device finds something else. And it's interesting the way you phrase that, the device, because the device finds, because in the IoT industry, that's not actually how it works. What actually happens is the cloud platform finds something else, and then there's a decision made. It could be a human being actually, a switch, or there's a push OTA. But one of the reasons I wanted you on our podcast series is this is the first case study of SMARTconnect. And as regular listeners will know, SMARTconnect is a really important initiative for us. It's essentially moving the device intelligence, the switching intelligence, if you like, the logic from the cloud into the device. And we think that's the next big thing. We think the device has to choose the connectivity. And therefore, if you're a customer, a company like you've got different devices that have different rules for what to happen, different use cases by different device types. And so if you can actually get the rules engine to be device resident, then actually you can then start to really customize and optimize and personalize the user experience. So to make it real, I know, so you've got, the AnyNet SIM, and you've got SMARTconnect, one of the very first adopters of it. But there was an incident in Canada, which I'd love you to tell the story if you don't mind. Because it really brings it to life of what happened.
Yeah, and so essentially what you were saying is to us is this. If that decision that you were talking about has to be made by a platform or made elsewhere, it needs to be communicated to the device. And if you've lost connectivity, it can't receive those instructions.
Yeah.
That's why they need to that logic, and that needs to reside on the device. And so in Canada, it was our first large installation in Canada, and it was a set of IVF clinics there. We were actually waiting for our work with you and all of our testing to be borne out before we provided that solution to them, because we wanted them to have the very best solution that could do this. And it was very shortly after our installation that we had what is kind of broadly known now as the Rogers outage in Canada. And so there was an outage. It was around 19 hours long, countrywide. And I guess the best part of this, right from the beginning, the simplest part of it rather, is that because we have a choice, even though we were talking about the same facility, different rooms of the same facility, many of the devices connected better to something other than Rogers. And so many of them simply weren't infected to begin with. For those who were, we had many of them reconnect within 30 minutes. The vast majority of them reconnected because of what you're talking about. The logic, the decision-making was resident on the device. And so it made that reconnection, knowing that it had lost its connection, made the connection to another carrier. And so it's something we simply couldn't do before. With our previous version, if we lost that connection, there's nothing we can do. We're at that is very similar to the situation we were in with Wi-Fi. Although we had more robust connection across the installed base, we still were at the mercy of someone else and something else as to whether or not when we could reconnect. Yeah.
And just to give a little more context for that, if people are listening to this and are intrigued, of course, what happened, of course, the Rogers network went out. It was one of the biggest outages anywhere worldwide, 19 hours, and in fact, it was ATMs were lost, emergency services were lost. I mean,
right.
This was mother of all outages. But typically, what happens with devices is the devices in this case, they thought they were connected because they had 5 bars on the cell phone. And that doesn't mean that the data path is available. It means that it's connected to the tower, and you kind of assume, well, the tower is connected to the network, and so the devices would keep on, no matter what they were, including cell phones, right? They keep on trying to connect to the network. They're trying to connect, and they don't know any better. Just saying, well, it's not available, and it's kind of like when you land in a plane in a strange city, like if I go to the US and I land I look around and I'm jealous everyone's already on their phone and I have to wait. But my phone has to register on the network. It has to find the data path, even though I've got 5 bars on my phone. I can't download my email, whatever. So if the device can't get a data path, it can't be communicated with to be told to switch.
That's right.
Outside of your control.
That's right.
Whereas in the case of SMARTconnect, you set a rule which says try the data path 3 times, this number of minutes apart. And if it doesn't, then on your own violation, switch to something else, because the IMSIs are preloaded in the device. So you basically are setting your own rules. And that's actually what happened. It's a nice case study. I mean, it's not a nice case study because nobody wants a 19-hour outage. But actually, if you need to prove an idea and you prove the value of a new technology, then to actually have a terrible situation like that is like battle proven. And I guess from your point of view, your client who you mentioned, a series of IVF clinics, that really raises your profile with them, because you were able to say, well, look, we recovered, we kept you in business, right?
Right. And so that period of time that we were talking about, getting close to 100% connection and uptime with your connection, as I mentioned, that is essentially risk. It doesn't mean anything necessarily went wrong, but you don't know. You're essentially blind to it until you get that data. And so our devices, well, although they collect a month of data, and they can backfill that data once it makes a connection, they need to know now if everything is okay. If
Yeah.
they're going to maximize their outcomes and protect their patients, they need to know right now. And so that's what it represented. It represented, again, minimizing that amount of time, the amount of time that they were unaware. 19 hours, that's a long work day for someone. They're generally not working a 19-hour day, and so much of that time they were actually at home, but they could still see remotely that everything was okay.
Yeah. And, we should say 19 hours is really unusual. I mean, this was a very famous outage.
It is.
But hey, even if it was 90 minutes, given what you said earlier in the podcast, if you want to take data every 5 or 10 minutes, which I think
we do every 5 minutes. Yes.
Every 5, right? So you take every 5. That's your value prop. And if the network's down for 30 minutes, you're only getting a sixth of the data. And as you said, a lot can go wrong in 30 minutes. So right. Yeah, that's one of the reasons why I wanted to chat to you, because our belief is that although clearly the MVNO model has abstracted the switch into the cloud and made it agnostic across the cellular operators, actually the ultimate destination of the switching logic is the device. And, and we'll talk about this in a future podcast, not just cellular switches, because, you can say if the Wi-Fi is available, and it's good quality, then use it. Or right. If not, if something else is available, if Bluetooth is available, then use it. Or if not, if cellular is available, then use it, but only use it if the signal strength is right. this, the latency is this, and the data path is open. So by getting granular, you actually have much more granular network switching rules, because you're using software to configure the connectivity. Right. Because the device itself, the modem, does not have that level of intelligence and that capability. So it's almost like a connectivity, configurable connectivity app for device management. There's so much here we can talk about. I actually want to, if we can, pivot as we get towards the end of the podcast, but into another subject. And it comes back to something you said right at the very beginning. It's to do with the regulator and that word continuous. I've been thinking about that word continuous since you said it. I was referring to, we've done multiple podcasts with healthcare companies, and it's clear that companies in the healthcare field, and it's clear that every single one of them has said the word continuous. And, the idea, actually, funny enough, I was explaining it to somebody today before the podcast, saying, well, the problem with healthcare, one of the problems with healthcare in general globally, is that it is the exact opposite of continuous. I mean, you catch something, let's just say in general, a disease, you catch something, you eventually you feel sick, eventually, then a few days later, you get around to making a doctor's appointment. A few days later, I don't know what it's like over there, but in the UK, it might be 5 days before you can get in to see the doctor. The doctor's a GP, general practitioner. The doctor then refers you to a specialist. Then you have to start again. You have to apply to see a specialist. You have to get to see the specialist. The specialist then says, oh, you need some tests. By the time they actually get to it, it's the opposite of continuous, right? And so the ability for the technology to continuously take measurements, and then the ability to go to proactive intervention and ultimately preemptive intervention is obviously the holy grail. And it's not just a desired outcome. There's a lot of people saying that the regulators are, and be it the drug companies that want this, or be it entities like the FDA or around the world, the equivalents, they're actually really very, very interested in continuous. And so, although every 5 minutes is like best in class, it could be in 2-3 years' time they want every minute.
Right.
Who knows? They may want.
Right.
Contracts may stipulate the ability to provide continuous monitoring. So that's got to be in your mind, because there's one parameter is every 5 minutes. One parameter is 98.5 to 99. Whatever, very close to 100. But the other axis is the frequency of taking it, and I think that's something which you're very conscious about as well. going forward?
We are, yeah, and so we send data every 5 minutes. That allowed us the right kind of resolution to see all of the trends that might affect us. Also, some of the equipment that we hook up to, the essentially its response time at times can be limited to about a 5 minute window. So in many cases, although we could take data more often, there was nothing to be seen in many of those cases
Yes.
tighter
Yeah.
than that. However, we, internally here, we're always innovating. One of the things that we've looked at, we're working on, is the ability to actually send data every 5 minutes, unless the sensor on board recognizes that you've had an excursion between those 5 minutes, in which case it would reach out and send that data immediately and the alert immediately.
Right, right. So event-driven,
That's right.
a data transmission within the 5 minute window,
Right.
which absolutely gets you closer to continuous, which really is the holy grail, because it is extremely hard to do. But by having event triggers, anomaly detection behavior, AI, ML type things, like if this happens and it meets these criteria, don't do anything. But if it doesn't meet these criteria and it's within these ranges, then transmit. And so the bar is always being raised on you guys, isn't it?
It is.
It's much more complicated than just connectivity. It's now sensor event types of data within certain parameters triggered transmission of data.
Yeah, exactly. And so the client need and the patient need drives the innovation. And then that availability and the innovation there then drives the regulations. Because as I mentioned before, even if there is something that's now available that is, but not broadly available, the regulations aren't going to force it until it's broadly available. But you have to innovate it first and get it out there and prove it. And so that's where we're at. We're at that cutting edge. We're riding on the crest of that wave, and we are seeing that regulations are changing over time based on what we and other companies are making capable and being available to be in the hands of everyone.
And I think it further reinforces the need for the device, because the device expertise and the device resident logic, because that data is collected at the device from sensors. As you said, not all the sensors are transmitting the data all the time, but increasingly there will be more sensors transmitting more data. And so it is you have to be able to collect the data, analyze the data, and have a framework to interpret the data at the edge.
Yes,
not at the center. Right. You've got
that's
this.
Right.
This problem can only be solved at the edge, not by calling it to the center, because you might transmit immediately.
So we've been known for years and years as having just the most advanced capabilities on our client portal.
Right.
But you're right. That's where the real innovation is happening, and what you can do at the portal. It depends so much on what happens at the edge and what you can do at the edge, and that immediate action has to happen at the edge. It can't be driven by the portal. It can't be driven by, the cloud software. It has to be right there on the edge, and they have to work in tandem, obviously. But you're right. That's where all the gains are. The biggest gains are to be made. Is out there in the environment at the edge.
Okay. Well. This is a story that's going to run and run, and applicable to so many industries, but particularly healthcare. I want to finish, if I can, Fred, by asking you to give advice to our listeners. We get a lot of feedback, and one of the things people say is, could you ask your guest what advice they would give to people who are embarking upon projects or are going to start again after a failed project, which is the most common environment, actually. But what advice would you give about a partnership and what partnership means, and lessons that you've learned in this process? Yeah,
so it's critical. You can't do everything yourself, right? That is an almost non-existent business model. You have to have the right partners who are the experts in their area. And so to me, it has to do with understanding your clients and understanding their needs and therefore our needs. We don't want to make jelly beans. We want to make the latest capabilities available to our clients. And so we're constantly innovating, and we're innovating for clients whose business is life and death. And so a sense of urgency, and the fast pace of innovation, taking taking the client very, very seriously, making their needs and their urgency your own. I guess what I'm saying is, choose partners that match your own values and your own sense of urgency, your style. And that's why we found Eseye was actually an excellent partner. Right from the beginning, in discussing with you, you were extremely transparent with us. You provided amazing references of other real world, customers that have been working with you for a while, and we could discuss essentially anything with them, and we did. But what we found through that was that you very closely match those characteristics we saw in ourselves that are critical to our success.
Okay, well, that's couldn't have put it better myself, and it has a lot more credibility coming from you than coming from me. But thank you for saying that. Fred, thank you so much. I'm sure the listeners found it really interesting, and something tells me that depending on how long we do IoT Leaders podcasts for, that there is a lot of demand. So maybe we're going to be doing it for a long time. I suspect that you're a potential candidate for a second episode, if only because things are developing so much in the healthcare field in general that that might well be we come back at some point and say, well, we thought that was cutting edge, and now look what capabilities we have now, and look at what the regulators are saying now, and look at what how the market is changing, et cetera, et cetera. But in the meantime, we'll have to draw a line under it. Thank you so much for your time today and explaining it so well and so enthusiastically. I'm sure people really enjoyed listening to it.
Oh, thank you so much, Nick. It has really been a pleasure. I would love to talk with you again, and there's no doubt we will have things to talk about because we are developing together.
Okay, well, let's don't tell your competition too much right now. We'll come back in the future.
Okay.
All right.
All right.
That was absolutely great. So you've been listening to IoT Leaders podcast with me, your host, Nick Earl. Thanks again for listening, and keep tuned in because there's more in the hopper that we're going to be recording and releasing, because there's so much going on in IoT, and there's so many exciting stories about innovation and business use cases out there. But in the meantime, Fred, thanks again. Thanks for being a guest on IoT Leaders, and we'll talk soon. Thank you very much.
Thank you.
Take care. Bye.